Hello everyone, this is Dr. Robert Lin, the airway dentist from Australia. So have you noticed yourself grinding your teeth? So have you asked yourself, why do you grind your teeth? Well, if it's happening during the day, it's often due to a stress or bad habit. However, if it's happening at night time, then it's predominantly an airway problem. So what is an airway problem? Well, some examples could include allergies, or you being sick, because obviously that's going to cause a blocked nose, right? Enlarged turbinates. Turbinates are the soft tissues inside our nose. So if they get enlarged, often due to allergies, it'll make it harder to breathe through your nose. Also a deviated septum. So maybe your septum didn't develop properly as a child, or you maybe had an accident, playing footy or something that caused it to be bent. Obviously that's going to affect your breathing. Other things you may have heard of are tonsils and adenoids. They will cause physical blockages of the airway. One that's not mentioned so often is a tongue tie. So if your tongue is tied, it's sitting low and back, especially if you sleep on your back. That's going to drop back further and clog up the throat region, so blocking the airway. If you have abnormally shaped soft palates or uvula, that can obviously cause airway problems. And also being overweight, especially in men, because we tend to pack our weight in our stomach region and around our throat region. So if there's lots of excess fat in this area, that's going to constrict the airway. So what happens during our sleep? Well, when we sleep, we relax, right? So and the muscles around our airway also relax. And sometimes it can actually collapse. And your brain, it can detect this when you're sleeping. So what happens, it goes into fight or flight mode. And one of the quickest ways to open up your airway is to clench or grind your teeth. So that'll open up the airway. So it's kind of like a protective reflex that stops us from choking in our sleep. Another thing it actually does is it regulates our parasympathetic and sympathetic nervous system. So it's that's one of the roles of sleep, is to stabilize the central nervous system. So often some symptoms we see in people who grind their teeth, obviously tooth wear is one of them. Like, you don't need to be a dentist to notice your teeth wearing away, right? Another common one is a jaw click from long-term wear and tear, or your jaw joint may just be like in the wrong position to start with. Other things like feeling tired during the day, because if you imagine you're grinding like throughout the night, they're like little micro arousals, so it's giving you poor quality sleep. So you often wake up unrefreshed. This can affect your hunger levels due to imbalanced hormones, your mood, and just your ability to deal with everyday stresses in life. So how do we get to the bottom of this? I tend to like to start with a 3D scan of the entire head and neck, so I can see where all the blockages are. Obviously, a clinical assessment in the chair. There's about 20 different muscles I actually palpate in the head and neck on each side to determine which are the ones that are firing at nighttime. In addition to that, sometimes I'll need to refer you to an ENT, throat doctor. And also for a sleep test, if I need to find out more information of what's going on and get down to the root cause of this. Now, if you'd like to know more, just click on the link below, and I look forward to hearing from you. Thank you.